Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them stat. Today, we wade into tick-borne flaviviruses, which are rare but dangerous jungle or countryside pathogens. Try these cues before we begin. Which tick-borne flaviviruses can cause bleeding and organ failure? Which one can be prevented by vaccination? Which one poses a risk to campers and hikers in North America? Let's plunge. Tick-borne flaviviruses are enveloped icosahedral viruses with a single-stranded, positive sense RNA genome, just like dengue, Zika, and yellow fever viruses. Their positive sense RNA can be directly read by host ribosomes. Flaviviruses can replicate in the cytoplasm without entering the nucleus. Their E, or envelope protein, helps them attach to and enter nerve cells. Their NS, or non-structural proteins, help them hide from the immune system by blocking interferon responses. All four viruses are transmitted by ticks, using animals such as rodents, monkeys, or muskrats as reservoirs to keep them in circulation. First is the tick-borne encephalitis virus, or TBEV. TBEV mainly affects unvaccinated residents or travelers in endemic regions of Europe and Asia. Incubation lasts 7 to 14 days, after which the biphasic illness starts. The first phase resembles a mild flu with fever and muscle aches, followed by a second neurologic phase with meningitis or encephalitis. Severe infection can lead to paralysis, long-term cognitive problems, or death. Next is the Kyasanur Forest Disease virus, or KFDV. KFDV mainly affects forest workers and farmers in India. After 3 to 8 days of incubation, the illness begins suddenly with fever and muscle pain, similar to early dengue fever. But unlike dengue, which usually causes small red spots on the skin from minor bleeding, KFDV can lead to a more serious bleeding phase. This bleeding may affect the gums, nose, and bigger areas of the skin. Sometimes, it can also cause bleeding inside organs like the lungs and intestines, which can lead to multiple organ failure and even death. Next is the Omsk Hemorrhagic Fever virus, or OHFV. OHFV mainly affects people living near rivers or wetlands in Siberia. After 3 to 9 days of incubation, illness begins with sudden fever and headache, followed by bleeding and, in some cases, nerve-related problems like confusion or movement difficulties. Bleeding can involve skin, gums, and internal organs, but unlike KFDV, OHFV often presents alongside neurological symptoms such as confusion or motor deficits. It's also more common in Siberia, not India. Severe cases may result in persistent neurologic deficits or death. Next is the Powassan virus, or POWV. POWV mainly affects outdoor workers and campers in North America. After an incubation of 1 to 4 weeks, illness begins with flu-like manifestations such as fever and headache. It can lead to encephalitis, causing confusion, seizures, or paralysis. Severe cases may result in long-term neurological problems or death. Unlike TBEV, which often causes a biphasic illness with an initial mild phase, POWV more frequently progresses directly to neurologic complications without a clear early phase. Bleeding is uncommon, making neurologic symptoms the primary concern, distinguishing it from KFDV and OHFV, which have prominent hemorrhagic features. Early symptoms of tick-borne flavivirus infections are often nonspecific, so clinical examination alone isn't enough for diagnosis. Lab confirmation relies on reverse transcription polymerase chain reaction to detect viral RNA and serology to identify recent or past infection. Cerebrospinal fluid analysis is used when neurological symptoms are present. Treatment for all 4 viruses is supportive, focusing on airway management, hydration, seizure control, and symptom relief. Prevention varies. TBEV has a licensed inactivated vaccine, but KFDV, OHFV, and POWV don't. Tick protection and avoidance help prevent all 4 infections. Let's review. Which tick-borne flaviviruses can cause bleeding and organ failure? Answer: KFDV and OHFV. Which one can be prevented by vaccination? Answer: TBEV. Which one poses a risk to campers and hikers in North America? Answer: POWV. All aces, jaw-dropping. If you learned from this clip, like, share, and tap subscribe. Scan the comparison table in the description. Thanks for watching. Stay hooked on Med in 5 for rapid med insights.